Now, India's active COVID-19 caseload has risen to a total of over 4,000. As per the Ministry of Health and Family Welfare, there have been as many as 203 fresh cases of COVID-19 and 4 deaths in the past 24 hours. Kerala is leading the chart with 1,435 active cases of COVID-19 amidst this ongoing surge. However, the state has reported only 35 new cases in one day. Since January 1st, the state has recorded 7 COVID-19 related deaths as well, the highest in the country. Delhi has recorded 47 new cases on Sunday, making it the highest single-day rise across India. The national capital's total active caseload of COVID-19 stands at 483. Maharashtra is also amongst the most hit states by COVID. 1 death has been reported from Maharashtra in the past 24 hours, while 21 new cases have been added, taking the current toll of active infections standing to 506, with this being the highest number of active COVID cases in the country since 2023. The big question is, when will we see the peak? Joining us at this point is Padma Shri Dr. Sanjeev Bagai, Chairman, Nephron Clinic. Dr. Ishwar Gilara, infectious diseases expert, is live with us. Dr. Salil Malik, Senior Consultant and Head Emergency Medicine, Felix Hospital, joins us live. Dr. Swati Maheshwari, Internal Medicine Specialist, is also with us live. Let me make a start with you first, Dr. Bagai. What do you make of this latest surge in COVID numbers, the highest spike coming in the last 24 hours from Delhi?
Yes, indeed. So, good evening. The numbers will rise. The more we test, the more we will diagnose. Truly speaking, COVID has never gone away. It is because of the surge which we saw, in certain countries in Southeast Asia and few cases here that we are now more aware again, and we are testing more again. Now, we've seen in my own practice, I've seen a couple of patients which are positive in the last week. Now, what are we seeing? We are seeing here subgroup lineages of Omicron. Now, this is the same Omicron which came around 2021-22 and has stayed since. It has now subdivided into almost 1,750 sublineages. And the parent group of this sublineage, which the 3 types we are seeing here in India presently, are from the parent strain of BA 2.86. So we are seeing basically 3 or 4 sublineages. The more common one in Indian diaspora is GN.1. We are also seeing LF.7 and NB 1.8.1. Now, these are names given because there are very unique mutations which are taking place in the amino acid, and these are called as flip mutations. These flip mutations have made these 3 sublineages more transmissible. That means person-to-person transmission has increased. 2 out of the 3 are binding more to the ACE receptors in the body, in your airway cells. But in gaining the specific unique mutations, now these are recombinant mutations. That means 2 different lineages mixed together and they form a new lineage. They have made them less lethal. So it's a trade-off. More transmissible, but less lethal. We will see more numbers because it's transmitting more. The doubling time is less, so we'll see more numbers. But here again, the case fatality will continue to be low as per data which is available today. The ICU admissions will be low. Hospitalizations indeed will be low. This is not what Delta caused as hypoxia and ICU admissions. So therefore, there will be no panic of antivirals and other kind of medications. India, as far as we are concerned, because of the 2+1 booster, 3 vaccines, 220 crore vaccines have been given so far in 2020, 21, 22, is in a good position in terms of immunity. But having said that, these mutations which we are seeing at the present moment are called as the fittest mutations out of the 1700 odd. Therefore, it means it evades immunity from past natural infections and the past vaccination. So the best way to go forward is to avoid the infection. We were not going to die from it, although the case fatalities are being seen in people with pre-existing comorbidities, pre-existing illnesses, and the vulnerable group. But having said that, long COVID is a distinct entity, even with mild infection, subclinical infections, asymptomatic infections. So it's better to be safe than sorry. Masking and social distancing is still primarily important, but clear message is there is no need to panic. Look after your own personal hygiene and own nutrition. Over to you.
Yes, Dr. Gilada, come in here on, what explains this spike, of course, being reported in India? Was it coming because of the cases rising that we were seeing first, of course, in Singapore, then in Hong Kong, and now, of course, in India? Is it attributable to this new variant? Is it more transmissible but less lethal? What do you make of this latest spike?
Thank you very much, Uday, for having me on the show. First and foremost, I would like to clarify to your viewers that this is not a new variant. This is a subvariant. We have seen only 5 variants: Alpha, Beta, Delta, Gamma, and Omicron. After Omicron came in 2022, there has been no new variant. That is number one. Number two, till a new variant comes, which is either equal to or more lethal, more dangerous than Delta, we need not worry, because we have been prepared for Delta-like wave now. Number three, when there was COVID during Delta time, there's a very famous saying that time, "100 bimar ek anar," and we were less prepared. Now today we have 100 anar ek bimar. So we are well prepared, but we have very less people which require hospitalization, ICU, ventilator, or they're dying. Now coming to the comorbid people which are with comorbidity, they can get A infection, B infection, C infection, any infection they can get. Only thing is that like Mundi badnaam hai, COVID badnaam hai. So COVID is like an influenza-like illness. If we do not give any credence or importance to influenza or RSV or mycoplasma, we should not give that kind of importance to COVID, because all along, all these 4 or 5 infections, sometimes influenza is up, COVID is down, sometimes COVID is up, influenza is down, mycoplasma is down. So that is going to happen. Most importantly, as Dr. Sanjeev Bagai said, that we have all been vaccinated. Beyond vaccination, each of us at least got a Omicron infection once. And then even though we check immunity in test, it will not be shown as we are immune, but there are memory cells. For example, if I seen you on TV screen and I meet you somewhere, my memory will trigger and say that, oh, this is Uday. So likewise, as soon as some subvariant of Omicron comes, our memory cell will trigger and will form the immunity. And what is happening is that we are just going by numbers. We are not even subtracting that there are 3,000, 4,000, but the people are recovering in 4 days. So you should subtract those numbers also. It depends on how many tests are done. If tests are more, number will rise. So numbers are not really rising, we are testing more. And most importantly, we should look at 3 things. Number one, how transmissible it is. Yes, it may be transmissible as compared to other subvariants earlier. Number two, what is the trajectory? How many of them are requiring severe illness and getting into that category? And number three, immune invading. So currently we cannot say that they are immune invading till we get healthy people dying which are not comorbid. So all the deaths currently in the country are comorbid people, and they are dying of that illness. Along with that, COVID positivity is additional finding. Over to you then.
All right. Let me, in fact, quickly rope in at this point Dr. Malik. Then, Dr. Malik, is it just certain parts of the country where this spike is happening, or is it now spread across the country far and wide? We were seeing, of course, earlier the numbers particularly high in Kerala. However, in the last 24 hours, the Kerala numbers have gone down. Delhi has increased. Also, we've been seeing Maharashtra being pretty badly hit as well. So is it restricted in certain parts of the country, or does it seem that it has spread out now across multiple states, Dr. Malik?
I have this feeling that whatever data that we are getting from major metropolitan area where the testing has increased right now, where the equipment is there. The people are more educated, they get themselves tested per se. And if you will also note that these cities are highly overcrowded. So that is also a factor because of which the transmission, since being high, so you are seeing that the rates are getting increased. However, even if the rates are not coming or are not getting reported from smaller city, tier 2 cities itself, so it's only a matter of time when the people start getting to know about it and get themselves tested also, and the facilities increase, the number of kits increase. So we might be starting to get a better idea of the spread altogether. But I hope with the rising number, the people are also being intelligent enough and taking things seriously through such mediums and spread of news, and they'll start taking precautions as earlier. I do not see too many masks being worn nowadays, not even people who are coming to the hospital setting. So I feel that as it will be a mixture of this, as the numbers grow, I feel it is ubiquitous, it is throughout India altogether. And though it is more in the metropolitans where the urban crowding is there, but as the number increases, so people will also start taking precautions, and then we'll get a sense here how much we are able to control it, and the spread is there.
Dr. Maheshwari, from your understanding of the COVID cases and the details coming to light so far, does it seem that people shouldn't be panicked by this latest spread? We are learning, of course, of certain fatalities. Is that a concern or not? Dr. Maheshwari, can you hear me? Okay, I think we've lost our connection. Dr. Gilada, why don't you take that? You were saying, of course, that the people shouldn't panic currently. However, the COVID fatalities number has risen. What do you attribute that to?
See, first of all, this is good that India.
Dr. Gilada? Dr. Gilada, are you able to hear me? Dr. Gilada, please go ahead.
Sorry.
Okay, I think we've lost Dr. Gilada as well. Doctor, let me quickly go back to Dr. Bagai at this point. Dr. Bagai, we are seeing the COVID fatalities figure go up. Kerala, of course, had reported a number of COVID deaths earlier. If this is not a very lethal subvariant, why are we seeing these fatalities numbers rise as well?
In terms of case fatality, it is always what we call as a corrected case fatality. That means your total number of deaths versus a given population, and total number of deaths versus the number of tests which have been done. It's on the numerator and denominator. I would still say that the case fatality is extremely low. At the present moment, it would probably be even lower than the influenza-related deaths. So the numbers, like I said, will continue to rise in terms of test numbers because now we are testing more. The only precautionary word which I will have is because of the summer season and the school holidays and the parents traveling with children and adults going for domestic or international trips, airports, aircraft itself are a great transmission site. So when you're in that crowded place, clustered place where the ventilation may be limited, it's always wise to wear a mask. But having said that, there is really no need for giving any medication for fever apart from simple paracetamol. Isolate yourself so that you don't infect others. Isolate yourself, discuss with your doctor even if it's required online. Not all fevers are COVID. Not all fevers require testing. So I think it's a clinical judgment which is taken by the doctors. I don't want the message going to public at large that every fever needs to be tested and recurrently tested. That is not required. Every sore throat doesn't even require an influenza swab. So I think we have to go clinically. Let's not put an extra financial burden on the parents or on the children or on families, plus not to create panic.
Yes, Dr. Malik, as far as, of course, now government hospitals though are concerned, do you believe it's prudent as we are seeing, extra wards being created, of course, sensitization done of different hospital officials and other authorities by the Ministry of Health, of course, at the central level and different state health ministers as well?
Yes, I think so. No doubt that with last time we have realized that we have the infrastructure and there is better preparedness also. Even by just sending a memo, we know exactly what has to be done, whether it is a private hospital or a government hospital, that what kind of beds are there, what kind of equipment is needed, what kind of trainings are needed. I'm also glad to see that we are having the oxygen preparedness drills also carried out in many parts of the country also. And I am sure the a number of facilities for making vaccines have been highlighted, and they are also an alert how to increase the amount of production over there itself, the number of kits that are being provided, so we are able to get them very easily itself. So the concerning the preparedness, I think so. Every single doctor, even the public, is ready for that to understand this thing. However, let us not forget that our message should not go that we need to panic immediately right now. I think so. The intelligence should be that we should be starting to take care of our elderlies and people who are having comorbidities and are at higher risk, and they should be intelligent enough to start taking precautions. Those precautions are the same, like people know, using masks and social distancing, trying not to go to crowded places. And I think so with that aspect, people should not panic at all, and they should feel confident that this time the whole country is well prepared and the healthcare system can take care of everyone out here. And it is just by luck also that the lethality is less. So even if the transmission is more, so we should just try to avoid risk people, and we should keep ourselves isolated. And I am hoping that soon we'll be coming out of this endemic that is there right now.
Right. I believe Dr. Swati Maheshwari is back with us now on the broadcast. Dr. Maheshwari, if you're able to hear me, I was trying to get you in here earlier on this latest spike, how serious it is according to you, and what you attribute, the numbers rising in certain parts of the country as well as the fatalities too.
Well, if you see the present situation, then one good thing is that a lot of genomic sequencing is happening right now, and ICMR recently released the data as well, stating that there are 4 subvariants of Omicron, which are attributing to the case rise that we are seeing right now. And all these 4 variants, which are subvariants of Omicron, they have high transmissibility. So definitely, what we are seeing right now is that more and more people are getting in touch with each other, and the cases are rising. But the good factor is that it is not that severe infection. And as we see cases in OPD also, and the kind of cases that are coming right now, what we see is more of upper respiratory tract infection, which is generally mild. So we're not seeing cases of lower respiratory tract infection or pneumonia, which actually get serious, and people start requiring hospitalization and ICU care and all that stuff. So as of now, the cases are quite limited, self-limited cases, which are getting recovering by themselves. So they just need little supportive treatment as of now. So that is the good thing that we are seeing right now. And even if you look at WHO, they have also stated that we are still considering it, despite the cases that are rising in a lot of other countries as well. They've considered it as a variant of monitoring and not variant of concern yet. So what we are seeing around is that it is a milder version. It is not a severe version. Definitely some cases, like you mentioned, that we have seen an uptick in the death cases as well. But then again, that is attributable to the fact that a lot of people have comorbidities and their immunity wanes over the time. And whenever a new virus comes in, they evade through the immunity, and people who are vulnerable, they kind of succumb either to the infection or they land in ICUs, because for them it becomes a serious infection. So that is the special kind of population that we need to safeguard. And most of the panelists here have raised concerns, especially for them, that this is a vulnerable population and we need to safeguard them. That's why people who are stepping out of their house, even if they are young, even if they have good immunity, they need to use masks. They need to do hand hygiene so that they don't bring the infection back home, where you might be having your elderlies, your children, and those are the ones who are vulnerable. So it is the onus on the people who are going more out, who are mixing with other people's. So please see that you use your mask, especially in poorly ventilated areas, especially when you are in crowded areas. Also, you need to follow hand hygiene. As over the years we have been talking about it, and everybody knows what to do. It's only that we see a lot of complacent behavior right now. People are not taking it that seriously, but it should be taken seriously, because precaution is something that easily can avert big problems, and that is what we should be focusing on right now. So if people are more cautious, if people follow all these protocols, then definitely we won't have those high surge that we have seen in the past, and definitely we'll be able to ride through this surge that we have seen right now.
Yes, okay. Dr. Gilara, let me quickly come back to you if we have your connection sorted as well on, of course, protocols now. People watching, what would you urge them to do? Also authorities in government positions, what would be your advice to them at this crucial juncture as well?
See, at this juncture, only people who are in scientific community, genome sequencing, they need to be bothered. And the government should have the preparedness. But there's no point in reserving beds for COVID when there are no beds for other patients. So if there are no special bed for flu, there are no special bed for RSV, there is no need to be special bed for COVID. You just say that we have isolation beds. So at many places, people in government authorities, they're reserving the beds. So what we do usually, first we create panic and then we say there is no need to panic. So please do not create panic. So at least this time, the governments are not given any kind of advisory to people. So that is a good thing. So there is no need of any advisory. Yes, what is required is only alertness. Be alert when there is a infection. Secondly, there is no vaccine produced since 2021. There are no vaccine. And a lot of people, experts say, do vaccinate. Where is the vaccine? So unless until we have a vaccine, we should not say about vaccination program at all, because there is no COVID vaccine available anywhere. Thirdly, our COVID vaccine, which was Covishield in 91% cases, that was much better than mRNA, both Pfizer mRNA and Moderna mRNA, and 100 times much better than Sinovac, which was from China. And that is the reason those China-driven countries, they have taken Sinovac, which has not provided them good immunity. People taken mRNA, their immunity was short-lived, 6 months, 8 months. But we had a Covishield, and there are scientific publications to say that Covishield was better. So at this juncture, there is no need of reserving bed. There is no need of any kind of advisory against travel. There is only need, if you have a comorbid people at home, elderly people at home, take precaution. When you're going out and bringing infection, mask yourself. That's it. The difference what we have seen during the COVID pandemic, everybody was wearing masks. Then we started having those who are having a cough or any kind of Ayla-like syndrome, wear mask. Now what is happening in our clinic also, we test for with COVID antigen, positive, then we ask them to wear mask. Till that time, we tolerate, they tolerate. So that kind of difference has happened, and that we need to be vigilant. Thank you.
All right, let me give a quick last word to Dr. Malik on the road ahead. Dr. Malik, at the end of the day, of course, we have to continue to monitor the situation currently, but obviously no need to panic. That's what authorities are saying. What would be your advice to citizens watching today? What protocols to adopt, particularly for the elderly, particularly to those with comorbidities? What would be your advice to them at this juncture?
So first of all, let me just mention for everyone, what do we mean by comorbidities? So people with diabetes, hypertension, who have chronic diseases like COPD, lung diseases like ILD, and then asthma. So they are at a very high risk. Similarly, people who have liver failure, heart failure, and renal failure, they are also at a high risk. Pregnant women, they are quite at a higher risk. They have low immunity, and any people who are taking immunosuppressors like steroids for any disease, whether it is post-transplant or for any skin disease, so they are at somewhat a higher risk. People above 65.
Okay, we've run out of time. Thank you very much for joining us. All our guests on this broadcast. We will, of course, keep a close eye on the situation further.